Hi there, I'm Dr. Leanna Dudley here at Denver Vision Therapy, and today I wanted to talk to you about something we do day in and day out, which is working on basic vision skills, or otherwise known as visual efficiency skills. Now this is different from 20/20, which means that you can see clearly in the distance at a moment in time. And basic vision skills have to do with how the eyes function to gather information and take them from the world through your eyes into your brain. And this is critical because you can have clear vision, but if your visual skills aren't functioning well, you're not going to be able to use that information you're seeing. It's like having a Ferrari without having a driver's license. It's not going to work very well. So what are these vision skills? So we've got eye tracking, and that's how well your eyes can follow a moving target or move from one thing to another, which is critical for reading because our eyes jump from one word to another when we're reading. The other is eye focusing, and this is kind of functions how a camera lens would function in your eye. So it's going to adjust focus between near and far, and this happens all the time without you being aware of it if it's working well. If it's not working well, you have to work very hard to keep your vision clear. The third one is eye teaming, and this has to do with how well your eyes aim at the same place. So in the distance, they should aim parallel, basically straight ahead, and when you look up close, they have to converge, and this means that they have to work to hold a posture to come together. If you don't have good binocular vision skills or eye teaming skills, you might have double vision, or you might have headaches or eye strain or other symptoms that can come up from trying to use your eyes together and keep your vision single. So you might be wondering, how do we tell if somebody has a problem with their visual efficiency skills? Well, first we start with looking at the patient's symptoms. And for kids, this can be really telling. Sometimes kids have been dealing with this their whole life. They've never known any different. And so we start to ask some questions, and we find out that they're seeing blurry or they're seeing double, and they just thought that's how it was supposed to be. They might prefer larger print when they're reading and avoid books with small print. They might avoid reading altogether and fight you on it. They might also have skipping words and lines when reading as a symptom. And they might have words that move around on the page or swim on the page. The other thing that can happen a lot with children or adults is eye strain and fatigue or headaches that come up as reading goes on, or computer work as well. And then you also might see poor hand-eye coordination, difficulty with writing, difficulty with reading comprehension, and there is a long list of symptoms. We do have a symptom checklist on our website if you want to take a look at that list of symptoms. There are many symptoms that can occur as a result of vision problems and/or learning disabilities. And we definitely want to take a careful look at what the patient's symptoms are to determine, and what their vision skills are to determine if they have a vision skill problem or a learning disability, or if they have both, which can occur quite frequently. Actually, in children who do have learning disabilities, we see a higher incidence of vision skill problems. So they do come hand in hand quite a bit. And what's important is that these kids who do have learning related issues, they are going to be spending more time reading and more time tutoring because they have to work extra hard to catch up. And we want to make sure they don't have the added burden of having vision problems or blurry vision, or their eyes won't track while they're trying to do their extra tutoring and all of that hard work that they're doing to catch up. So we can remove the visual barrier and then let the educators do their thing. So what's the next step if you think that yourself or maybe your child might have difficulty with vision skills? Well, I think the next step is to give our office a call, because our front desk staff is absolutely fantastic about talking with the families, deciding if they're a good candidate. We don't want patients here who are not good candidates for the services we provide. So we make sure everybody's symptoms and their history line up with the kinds of things that we can help with. And they spend a lot of time educating people on the phone about what we do. I'll give a little summary here though. So the initial evaluation is usually a 2-hour appointment. And during that appointment, we'll do all of the testing, but we'll also check for prescription. But we'll also do all the testing for all these visual skills, as well as visual information processing skills, such as visual memory, visual discrimination, letter reversals, and a whole bunch of other things. And we'll also do a screening to see which of our treatments would be best for the patient. After the initial evaluation, we'll do a 45-minute consultation, and that can be over Zoom or in person. And then we'll go over everything that came from the evaluation, all the results. We do have a graph that we use for the visual efficiency skills, and that shows us where that person's performance was compared to normal. And this can be so powerful to describe how much that person is struggling. It's also really great to be able to track progress as the patient makes improvements, so we can see the bars rise on that graph. And the kids really enjoy seeing that, and they are very much empowered to see how their hard work can translate to good results. As a result of this initial evaluation, we'll determine which of the treatments are going to be best. Some of our options do include vision therapy, which is weekly in-office sessions, or remote vision therapy. But we also, of course, are going to look for what is the best glasses treatment for that person. We also have color light therapy, which is also called syntonics, as a treatment option. We have colored tints, we have colored overlays for patients who have visual snow syndrome or other kinds of light sensitivity issues. And we're going to be looking at all of these to see what's the best combination of treatment options for that patient's case. The other thing I want all the kiddos to know about the initial evaluation is we don't do eye drops at that appointment. So we are going to do that at another time if it's needed, but oftentimes the assessment will come from their primary eye care doctor if that's been done recently. The other thing we've had a lot of success with is our remote vision therapy program. We've been able to help patients who live 3 or 4 or more hours away, because if they can make it to an appointment to see me every 3 months or so, then we can do the progress checks, and then they can do all of their vision therapy remotely through the computer over Zoom. Our vision therapists are absolutely fantastic about finding ways to engage with the patients and find interactive, fun activities to do. And then they, of course, give them the home activities, which is how the repetition changes how the brain controls the eyes. And we find that these patients have just as much success as our in-office patients, which is absolutely fantastic. So if you are interested in learning more about vision efficiency skills or anything else that we do here at Denver Vision Therapy, you can check out our website at denvervt.com, where you can give us a call or text. We look forward to talking with you.